Hello and welcome to MedTech Frontiers. I'm Mike Heyl and I'm joined by my colleagues Jared Wessel and Josh Gelula. We're all attorneys in the global regulatory sector at the law firm of Hogan Lovells. I'm in the medical device and technology practice, and Jared and Josh both practice in the firm's international trade practice. As you know, this series spotlights the pivotal forces shaping the medical device industry in 2025 and into the future, and today's no exception. Today's episode is the first that covers topics outside the scope of FDA regulations. This episode covers the recent Section 232 investigation initiated by the U.S. Department of Commerce's Bureau of Industry and Security. This investigation could have significant impacts on the medical device industry, and today we've got two experts that practice in the space that can really talk about what the implications of this investigation could be, what triggered it, and what are the potential impacts for the medical industry moving forward. So thank you both, and with that, I'll hand it over to you.
Thank you. It's a pleasure to be here. My name is Jared Wessel. As Michael alluded to, I'm a partner here in the International Trade Group at Hogan Lovells. One of the main topics that I think we'd like to discuss today is the Section 232 investigation on medical devices. Section 232 is a provision administered by the Department of Commerce that has been used in the first Trump administration to put tariffs on products for national security reasons. So in the first Trump administration, there were Section 232 investigations launched against imports of both steel and aluminum. As a result of these investigations, the president imposed tariffs of 25% that have recently gone up to 50% on imports of steel products as well as aluminum. In the second Trump administration, those tariffs have largely expanded to cover derivative products. So originally, the tariffs covered steel pipe. Now they cover a number of products that are not predominantly steel, but cover steel. In the second Trump administration, the president used Section 232 again to launch a series of investigations on products such as semiconductors, pharmaceuticals, and most recently, medical devices. The investigation was launched in September, and under the Commerce's regulations and the implementing statute, Commerce has 270 days to issue a report to determine if imports of medical devices pose a threat to the national security of the United States. We're expecting that the report will come out sometime in the summer. There's always a possibility that it could come out earlier, but it should come out no later than sometime summer of 2026. Under the president's Section 232 authority, he has the ability to impose a number of measures, such as tariffs on imports, if Commerce determines that imports of these products do pose a threat to the national security of the United States. There were roughly 400 comments filed under the comment procedure for the medical device investigation. Some of the comments discussed why this would cause an increase in prices for the U.S. consumer. Some of the other comments discussed why this could lead to increased healthcare costs for insurers, for the U.S. government, for Medicare, Medicaid, and Veteran Affairs. Obviously, unclear where the administration might come out, but it's certainly something that clients need to be aware of.
Thanks, Jared. So I think one of the things I want to add in terms of the scope of what we've seen, Jared alluded to a number of the comments that were provided and some other additional comments related to whether the administration should exclude certain type of essential medical devices perhaps that aren't able to be produced in the United States currently, as well as should there be a tariff-free or tariff reduction zone for certain blocks of countries that are allied nations or friendly nations, and so providing reduced tariffs, similar to what we have seen in some of the other Section 232 tariffs where goods of USMCA origin have been provided duty-free import in the United States and exemption from the relevant 232 tariffs.
There have been a number of tariff exemptions that companies have used to avoid other tariffs and put in place on the Trump administration. So Section 232 is largely a product-specific investigation. So Section 232 examines steel, it examines aluminum, it examines semiconductors. In previous investigations under Section 301 and some of the other IEEPA tariffs that the president has used, the tariffs are more focused on countries. So, for example, in the first Trump administration, the president launched a Section 301 investigation of imports from China. And this essentially covered a large swath of products that we were importing from China. There were a number of tariff exemptions under Chapter 98 of the Harmonized Tariff Schedule of the United States that importers, including importers of medical devices, used to avoid those tariffs. One of the prominent examples was the Nairobi Protocol. The Nairobi Protocol allows importation of medical devices in certain situations if they are used for people with physical disabilities. Again, it's a very exacting standard to use Nairobi, but that is something that some medical device companies have used in the past for the Section 301 and the IEEPA tariffs. Another kind of prominent question in the Section 232 investigation is what will be the fate of the Nairobi Protocol? Is this something that will continue given the large duty-free access that the United States enjoys under Nairobi to export to foreign countries, or is that something that could potentially come under Section 232 duties as well?
Yeah, great point, Jared. I think there were a number of the Section 232 tariffs we've seen to date issued by the administration have allowed for most of Chapter 98 provisions, including Nairobi Protocol, to be made eligible, but obviously in the medical device context is more relevant to the Nairobi Protocol, as these are goods that are specially designed for the handicapped and thus would encompass more of the medically device products that to date have been outside the scope of existing 232 investigations or the April 2nd reciprocal tariffs because of the exemption or items that are within the scope of the existing tariffs.
Yeah, Josh raised an important question about the automotive Section 232 investigation. So the way that works is that the president has allowed a tariff exemption based on the manufacturer's suggested retail price of automobiles that are assembled in the United States. What the auto companies are allowed to do is take a percentage of that MSRP, and that's a tariff offset that they can use for products that are coming into the United States that can then offset their tariff liability for products that are assembled in the United States. Again, an open question if something like that could potentially come for medical device companies as well. But in the meantime, I think we're certainly advising clients, and I think is always kind of good, what I call tariff hygiene. Certainly know your supply chains, know where your product is coming from, and understand your supply chains. Normally in the United States, there are tariffs imposed based on the country of origin, which is determined by substantial transformation, which generally been the standard for Section 232, Section 301, and some of these other tariffs. But there have been discussions of potential component tariffs, that some of these tariffs may someday be driven by the amount of components, for example, from China that could dictate your tariff treatment. So it's always good to know as much as you can about your full supply chain. It's also good to try to take steps to officially report your customs valuation. Examine if there are ways to keep your customs valuation as low as legally possible. There are mechanisms in place, such as first sale, that would allow you to report a lower customs value. Those are certainly things that you should be talking to your trade compliance people about, trying to keep that tariff liability as low as legally possible.
I think too, when looking at your supply chain, is what options or avenues do you have to potentially modify your existing supply base to move to countries with potentially lower or more preferential tariff arrangements? If you look at some of the agreements that have been put in place with the EU and Japan, again, these are the bilateral agreements that have been announced, have indicated that the pharmaceutical products, patent and branded pharmaceuticals, would be at a lower tariff rate than the global tariff rate on the pharmaceutical 232. And so similar considerations may be in place in the medical device 232 when those are announced. So thinking about where your sourcing is coming from, where you potentially could move your manufacturing to, including potentially moving to the United States or having at least some supply base in the United States, if there's going to be an exemption for production that's manufacturing capacity that's done in the US for medical devices. The other piece, as Jared was thinking about the supply chain of if you have products that are being brought in for processing in the US, but they're actually going to be re-exported for sale in another jurisdiction, medical devices destined elsewhere. There are certain provisions under temporary importations under bond for processing devices under Chapter 98 that could be another avenue for mitigating some of the tariff liability.
Thank you both for this informative episode. If you have any questions, please feel free to reach out to any of us. Our contact information is available on the firm's website. Our next episode is going to be a follow-up to one of our first ones, where we're going to be examining the recent compliance and enforcement trends at the FDA and how those are affecting the medical device industry. Manufacturers really need to remain prepared for what's happening and shaping up to be a very active enforcement climate. So thanks again to Jared and Josh and for joining us, and we'll see you next time on MedTech Frontiers. Thank you.